Are you frustrated, exhausted of poor working conditions and pay? Do you want to leave your NHS job as a nurse but you don't really know what you can do? Let me give you some ideas. Hello, my name is Nurse C. So if you're new here, welcome. And if you like this video or podcast, please like, share and subscribe. Let's reach 1,000 subscribers together. We're gonna start a new podcast. The different and the various job opportunities available for nurses outside of the NHS. We'll cover the different job roles, application portals, and even give you an idea of earning potential in you. So let's dive in. So this first video, we're going to discuss the career opportunities for nurses in the private sector hospitals and clinics throughout the UK. We'll delve into the advantage and disadvantage of working in private healthcare compared with the NHS and provide insights on salary expectations. So let's get started. So what are the advantages of private sector nursing? Nurses might find several advantages when working in private hospitals and clinics. The first one is safe staffing or low patient to nurse ratio, because private facilities often have fewer patients per nurse, which can lead to more personalized care and less hectic work environment. Enhanced professional development. Private hospitals and clinics often provide more education opportunities and access to advanced technology. Flexibility. Private facilities may offer more flexible working hours and better work-life balance. So what about the disadvantage of working in private hospitals? First, you might have limited exposure of complex cases because nurses in private facilities may not see as many complex medical conditions as we tend to see and be treated in the NHS. So I really recommend, if you're new to nursing, start in the NHS because there you'll have a much more broader experience. Second, you might have less comprehensive benefits. While the private sector salary may be higher, the overall benefits package including pension, holidays and sick pay may not be as competitive as the NHS. Smaller teams. Private hospitals and clinics often have smaller teams, which can limit the network and collaboration opportunities that compare with the NHS. In terms of salary expectations and negotiating tips, salaries in private sector hospitals and clinics can be slightly higher than those in the NHS. However, it's crucial to carefully evaluate your salary offer in comparison to the overall benefits package provided by the NHS. This is something that I know because I've applied to many private hospitals here in the UK to understand what they offer, and as far as I was concerned, from my experience, I found that the pay that they were offering me, even with the negotiation, was below the rates that the NHS offer. If I take into account the NHS pension, the sick pay, and many other things that the NHS offers compared with the private. So just be extremely careful when you're looking at private sector. Might not be as excited as you may expect. The pay for nurses in private sector and clinics can vary depending on the factors such as experience, location and the specific role. On average, nurses in the private sector may earn between 25,000 and 80,000 or even more per year. Senior positions and specialist roles such as nurse practitioners, clinical nurse specialists or directors of nursing may command higher salaries. So keep in mind that while base salaries in the private sector may be slightly higher than those in the NHS, it's important to consider the overall benefits package when comparing job offers. As mentioned earlier, private sector benefit packages may not be as comprehensive as those provided by the NHS, so it's essential to weigh the pros and the cons before making a decision. And before accepting a job offer, considering the following. Compare the salary offered to your current NHS benefits package, taking into account pension, holidays and sick pay. Assess the potential for professional growth, including education opportunities and the exposure to new technology. Negotiate your offer, and if it doesn't meet your expectations, or if the benefits package is less comprehensive than what you receive in the NHS, maybe the offer doesn't align with your needs, so think twice before making the transition to the private sector. That concludes our overview of the private sector hospitals and clinics, including the advantage, disadvantage and salary expectations for nurses in the UK. Not convinced? Check our videos about working in care homes and many other nursing career opportunities that I have prepared for you. Stay curious and keep learning.